Ladies and gentlemen, it gives me great pleasure to introduce our keynote speaker, a native West Virginian. She currently serves as the Deputy Administrator of the Health Resource and Service Administration, or HRSA. In this role, she works to fill healthcare gaps among the country's most vulnerable and underserved populations, a mission very much aligned with our own. During her career, she's been hugely influential in a number of initiatives that work to improve healthcare coverage for uninsured children, while also working on health policy, research, and grant activities that promote better health care services for rural Americans. A passionate healthcare educator and policymaker. Please join me in welcoming Dr. Marcia Brand to the West Virginia School of Osteopathic Medicine.
Thank you, Dr. Edelman. Good morning, graduates, parents, family, friends, and faculty. Thank you for the opportunity to be a part of this important day. And congratulations to you, the graduate of West Virginia School of Osteopathic Medicine, class of 2014. You will remember this day for the rest of your life. It is one of a handful of days that marks a transformation in a single day to a new era in your life. As of today, you are now a doctor. There will be other days, your wedding day, the birth of a child, the purchase of a home, that will be transformative as you become a spouse, a parent, a homeowner. But today you are a doctor. Incredible the difference a day can make. I hope this is one that you will remember as glorious. I also hope that someday each of you is asked to give a commencement speech. It's an interesting experience. If someone such as Dr. Edelman calls you up, sort of out of the blue, and invites you to provide a speech at his college's graduations, it means that a college committee somewhere thinks you are an accomplished individual, that you would have something important to say to the graduates of the institution that the members of that committee care about deeply. Receiving this invitation was both wonderful and challenging. Wonderful to be recognized as having made a contribution to my field, as someone who might have something important to say, and challenging to determine what I have learned that would be meaningful to share with you on a day when what you really want to do is just get that diploma and get on with the day and enter this new era of your life, the day when you become a physician. What I want to talk to you about is transformation. Your transformation to a practicing physician, and within the context of a transforming healthcare system. You are becoming a physician at a time when healthcare in the United States is undergoing perhaps the greatest transformation in half a century. In fact, since this class began its studies 4 years ago, the healthcare system in this country has been changed forever and for the better, and good timing for you. Now it is up to your generation of physicians and those who follow to do all you can to see that the people in the communities you serve have access to the care that they need. The admissions committee who selected you for the class of 2014 had a lot to consider. Foremost, they selected applicants who would help them deliver on their mission to educate physicians who will serve underserved areas with a focus on primary care and on rural areas. The West Virginia School of Osteopathic Medicine is recognized as one of the nation's top medical schools for rural medicine, and the faculty and your soon-to-be patients are hopeful that you, the class of 2014, will support that commitment. The School of Osteopathic Medicine is hopeful that you will work with underserved rural communities, many of them in West Virginia and Appalachia, and so am I. The agency for which I am the Deputy Administrator, the Health Resources and Services Administration, uses its $8 billion budget to improve access to quality healthcare services for underserved communities. We support 1,200 community health centers with 9,000 local sites pretty evenly divided across rural and urban communities. We placed almost 9,000 primary healthcare providers in places that struggle the most to recruit and retain a healthcare workforce through the National Health Service Corps. P.S. That program can help you pay off up to $50,000 of your student loans if you are willing to work in one of those underserved sites. So if any of you have acquired an educational debt over the last 8 years or so, you might want to check into the Corps. We also run the government's Office of Rural Health Policy that provides grants and oversees policies that support healthcare in rural communities. So your college's mission to educate physicians who will serve in underserved areas with a focus on primary care in rural communities is very consistent with HRSA's mission. It's the same reason that 1,800 of us pointy-headed bureaucrats or seriously dedicated public health professionals get up and go to work every day to improve care for the underserved. But also with me, it's personal. I am from West Virginia. I came back. I grew up in Martinsburg. I graduated from Martinsburg Senior High School. My folks are from Morgantown and Kingwood in Preston County. I went to school at WVU for a while. What you do with your training as an osteopathic physician matters to me personally. I care deeply about Appalachia, and in many places, our people are not doing as well as the nation as a whole. The health statistics are trending in the wrong direction in some Appalachian counties. In these counties, life expectancies are getting shorter, not longer. There is a troubling high premature mortality rate in the 35 to 64-year-old age group. The burden of chronic disease, cardiovascular disease, diabetes is increasing rather than decreasing, and these negatively impact the productivity of the population when we most need and want a healthy, vibrant workforce. I remain hopeful, however. You can make a difference in the health outcomes in those committees. Your college picked you from hundreds, if not thousands, of applicants with that thought in mind. You can make a difference. So let me tell you how you can make a difference. I figure that you're going to practice medicine for about 50 years, give or take a few years. And while I know that graduations are all about looking forward, I want to take you back 100 years to look at how an Appalachian family, my mother's family, experienced changes in population health over a 50-year time period beginning in the 19th century. The magnitude of these changes will be mirrored again in the changes that you will see over the course of your medical career. This is a photo of my great-grandfather, Spencer Crane, and his bride, Myrtle Welch, on their wedding day in Preston County sometime in the late 1890s. Spencer had a farm and raised dairy cattle. His son, Smith Crane, was my grandfather. This is a photo of a Crane family reunion in 1915. These people would have arrived at this event by wagon or on foot. My granddaddy, Smith Crane, is in the last row, fifth from the left. You don't see Spencer, his father, in this photograph. Spencer died from a brain tumor when Smith was in the 5th grade. This despite the fact that the family took Spencer to Philadelphia to Jefferson Medical College, the best care available in that day, to have brain surgery. The surgery proved unsuccessful, and after his father died, Smith dropped out of school and ran the family dairy at age 12. As you look at this photo, you'll note that there are very few old men. They have all died of cardiovascular disease. And no one is wearing glasses, and no one is smiling. If you look at the tips of their noses and their chins, there's a lack of vertical dimension, as we say in dentistry. Most of these people are partly or completely without teeth. This is a photo of my grandfather, Smith Crane, on his wedding day in about 1918 or so. You have to admire his really enthusiastic hair and the size of his hands, the hands of a dairyman. He is marrying Bernice Zanella Ashby, That's Bernice, not Bernice. As an aside, I am forever grateful to my parents for not naming me for either of my grandmothers, the other one being Myrtle Bell Brand. In any combination, Bernice Bell, Myrtle Zanella, I would have been compelled to find a nickname. What's lovely about this story is how they met. Bernice was from Oakland, Maryland. She had gone to college at West Virginia Wesleyan. She came to Preston County to teach in the Crane School on land Smith donated to the county. They fell in love, and Smith married the education he never completed. Smith and Bernice lost their first 2 children in childbirth. They never spoke of them. They went on to have 4 daughters and a son. One of their daughters was my mother, Jean. This is a photo of the Crane family reunion in Kingwood, West Virginia in 1938. These folks probably arrived by car. My mother is in the second row, 4th from the left, with her hands on my Uncle Bill's shoulders. He has on shorts. Important to note here, no one is overweight. They are engaged in the agrarian economy, or they are miners. Housekeeping and feeding a family kept the women active. And perhaps, as my mother often reminded us when my siblings and I complained about something we were being asked to do that seemed to be just too much, perhaps she and her siblings did walk 3 miles to school, uphill each way, regardless of the weather. As I look at this photo, I think she might have been telling the truth, at least about the walking part. This is the Crane family reunion in 1955 or 1956. The cute kid on the right side behind the box is me. I'm sitting in front of my mom and my dad. Both of my grandparents are in this photo. It appears that the elders are seated in the front row, and there continues to be a disproportionate number of old women. In the older generation on that front row, no one is smiling because they are edentulous. But in that second row, these folks have their teeth, they are smiling, and the folks who need glasses have them. Skipping ahead, this is the Crane family reunion in the mid-1980s. We turned out okay. There are a lot of us. Smith and Bernice were married for more than 60 years and lived into their 90s. In this photo, there were equal numbers of older men and older women, big smiles all around, lots of robust little kids. One of my aunts and my uncle had bouts with cancer, but were able to continue to lead productive lives afterwards. The family has prospered. My mother's generation went to college, and so did my many cousins. Looking back through these photos, you can see through one Appalachian family the advances medicine has made in addressing infant mortality, cancer, vision care, dental health, and cardiovascular disease. Looking forward, we know that the increasingly rapid pace of medical advancements and health systems redesign will shape your future practice. You will be working differently from the providers who cared for my West Virginia family, the iconic physician in solo practice. You will be working in interprofessional teams and multi-site practices affiliated with medical centers. Dusty, thick manila folders on shelves that were the charts of the past have been replaced by interconnected electronic health records. You will use those electronic health records, all that information, to measure and track health outcomes. And while you will continue to focus on the wellness of individual patients, improving both the quality and quantity of their lives, you'll be prepared to use data to improve the wellness of practices, communities, and populations of people, especially those who face barriers to improved health outcomes, whether they be socio-demographic or cultural, or if they are related to geography in underserved areas such as Appalachia. I want to circle back to one of my earlier concerns about health outcomes in underserved rural communities. Today's best practices in healthcare are not working in those counties where lifespans are decreasing and chronic diseases are on the rise. You can use the information that you collect to find out what does work in improving health outcomes in those counties and reverse those statistics. And one more note, if you practice in rural communities, you will need to embrace and foster health systems innovation because the need is so great and the resources are limited. Your degree comes with stellar preparation for this future, but also with a great responsibility, a responsibility to many families, families like mine and yours and your neighbors. In closing, I want you to think back to when you first felt the call to practice medicine. You answered that call. Never forget that inner drive that brought you down this career path. Never forget how much hard work it was to get here and why you set this goal for yourself. My hope for you is that becoming a physician turns out to be everything you had desired and more, and that the people in this region and beyond will benefit from your achievements. Thank you for inviting me to share this important day with you. Congratulations, best wishes on this day of transformation. Thank you.